Now we're going to want to understand what are some of the causes of leaky gut in order for us to start reversing some of its effects, right? And some of the symptoms that cause it. So in looking at us as a mainstream, as a whole, and as a society, we were first introduced to an antibiotic, penicillin, and that entered mainstream healthcare in about 1939. Now, since the 50s and 60s, antibiotics have been used frantically to prescribe for every infection, including inflammation, particularly pediatric ear infections, bronchitis, sore throat, you name it, right? So now primarily, it's been mostly antibiotic use, but secondarily, we've also been using very, very liberally non-steroidal anti-inflammatory drugs as well. So these are called NSAIDs. Now these NSAIDs would include things like ibuprofen, Aleve, naproxen, and they're for, general pain relief for headaches, pain, just light pain here and there, from overuse of maybe muscle soreness and stuff like that. And with those NSAIDs being the major cause of leaky gut, this is because they so viciously inflame the intestinal lining, causing a widening of the spaces between the cells and sometimes hemorrhaging. So we go back to the first video where it's explained how that leaky gut occurs. And this is one of the number one causes of the leaky gut, is taking in NSAIDs and antibiotics. Now, other common causes of leaky gut is going to be like chemotherapy, ingested alcohol, inhaled formaldehyde from maybe like new carpet. I've seen a few of my clients get extreme organ malfunction from laying new carpet in a house, pulling up the old carpet. Who knows what's underneath there? There's spores that can attack the lungs, start to damage the organs internally, and then we see that toxin burden in an overabundance, and then the body starts to degress and it can't fight the normal fight. Being in a brand new building or in a new building or old building for long periods of time, like so maybe a teacher in an old building, have a lot of clients that are in that kind of situation as well, struggling with a lot of autoimmune disorder because of what they're exposed to on a daily basis. The body just can't keep up with processing those toxins. And so this becomes quite the issue, and then we start to see disease start to occur, and it becomes where it takes its toll on the person and their overall mental and physical health as well. So some of the other causes of leaky gut include stress. So this is going to be stress from emotions. Your body does not know the difference between good stress and bad stress. Let's say you're getting married, that's an exciting time, things are changing, but your body doesn't know the difference between the getting married and you being chased by a tiger or trying to get to a deadline. It just perceives stress as stress. It doesn't know the difference between good and bad. And so we really have to manage our stress very carefully so that it doesn't take its toll on the body. And I like to tell my clients too, manage your stress or your stress manages you. And that's really the truth. Also, some other issues that cause the leaky gut are going to be foods such as lactase deficiency. So that would be the inability to break down lactose. Okay, so then we see some food particles slipping through that gut lining into the bloodstream where they don't belong, like we said in that first video that explains it really nicely. Allergies or sensitivities to gluten or gliadin, wheat, corn, soy, eggs, and peanuts. So these are extremely common in food intolerances and food particles slipping through, making that gut extremely leaky, causing a whole bunch of symptoms, right? Especially brain fog, trouble with memory, trouble with focus, ADD, ADHD starts to really affect the brain, especially when it's the gluten, wheat, or gliadin, okay? Now, also abnormal gut flora. And that's going to include things like bacteria. When we have way too much bacteria in the intestinal wall and in the intestinal lining, running through our digestive tract, parasites, and yeast. You know, an overabundance of any of those is really going to offset that gut flora. You know, that entire gut is its own ecosystem. There is a whole slew of things that have to happen in there, and we really need to make sure that we have a nice representation of good bacteria in there, as well as, you know, some bad's fine because that's what the good needs to eat. So we definitely want to make sure that we're not having way too much overgrowth of bacteria, parasites, or yeasts in the gut. Okay, and yeasts are going to be things like candida. So if you've heard that term before, that is a yeast, and that is something that definitely we don't want in overabundance. Okay. Now, it is sadly ironic that most of these infections are viral in nature. And not only are antibiotics damaging, but they are ultimately unnecessary. So antibiotics really should be heavily considered as probably a medication that should be used at the hospitalization level when there is a bacteria present that's entered the blood, the bone, or the organ under the guidance of a primary care physician or healthcare practitioner. We want to really utilize your body's own immune system to help ward off and fight some of these things that are really, really minute, and not jump right into that antibiotic because really, essentially, one antibiotic takes about 6 months to restore the flora of the gut, okay, just after one antibiotic. So imagine having multiple antibiotics being used in a 6-month to a 1-year period. That's going to take multiple years to help balance that ecosystem that we just talked about out, okay? And so we'll move on to the next video. I thank you for watching.